Dear colleagues and friends, thank you very much for the invitation to take part in American Venous Forum. It's a great honor for me. First experience of using Russian sulfakrilat glue, clinical and morphological study in vivo. Within the last years, several new devices have been introduced, referred to as non-thermal and non-tumescent techniques. When I see them in a block, markets have been closely integrated in the everyday practice. In 2027, the venous seal vein occlusion system was registered in Russia, but the main problem is a cost. That is why we found it most interesting and relevant from a practical point of view to study the Russian developments of glue compositions. In Russia alone, over the past 10 years, more than 30 sulfakrilat medical formulas have been synthesized, and having analyzed in detail all the Russian developments presented to date, we have come to conclusion that the sulfakrilat adhesive compound can be used as a potential occlusant. The Russian adhesive sulfakrilat was synthesized in 2000 in contrast of foreign analogs of based on ethyl ester of alpha-cyanacrylic acid, not butyl. In 2010, it was registered in Russia. The purpose of the study was clinical, instrumental, and morphological in vivo justification of efficiency and safety of the use of sulfakrilat. From May 2019 till July 2020, endovascular catheter obliteration of the main trunks of the great and small saphenous vein was performed using the sulfakrilat glue 48 patients with varicose disease. The dose of vein glue depends on the diameter of the target vein. 1 cm diameter 0.1 milliliter glue is used for every 5 cm treated. We evaluated pain, thrombophlebitis, local and general allergic reactions, the possible spread of the glue in the proximal and the distal direction of the great and small saphenous vein. Histological study of morphological changes in vivo was performed with the concern of patients to conduct the study. From 15 patients within the period from 7 to 180 days after the introduction of the glue into the lumen of the vein. Pain after 48 hours was observed in 28 patients, 58%, and 12 patients reported moderate pain, WASH score 4-5. Results: there were no cases of glue extension into the deep veins and no allergic reaction in the patients. In 6 patients, when the glue reached the subcutaneous fat, there was singular septic inflammation that did not require any treatment. 1 month after sulfakrilat glue injection, neoangiogenesis and aseptic inflammation. 6 months sulfakrilat glue injection, extensive zone of molecular fibers destruction, granulated tissue, and 7 months, the whole or thickness of glue composition actually format degeneration, granulation tissue. During the histological examination, 7 days, gradually relieving aseptic inflammation, and half a year in absence of glue particles, which was indicates of its biodegradation. The anatomical success 100%. Why following the glue injection technique we did not observe the problem of glucine in the delivery system? Conclusion: sulfakrilat aggressive embolization of incompetent truncal veins using the Russian glue sulfakrilat is a safe and effective procedure. The high adhesive ability of the glue contributes to the absence of extension into the deep system. The glue is biodegradable. The Russian glue is a low-cost treatment which can easily be performed as an office-based procedure. Thank you very much. Russian vein glue is a very simple system. We don't need additional gun, and we use additional dilatator with a specific material because the Russian glue is very liquid like a syrup. We introduce the dilatator inside the vein to saphenophemoral junction about 2 centimeters, and then the continuous method, drop by drop, 0.1, 0.2 milliliter for every 5 centimeter of the vein. You see the lines, 5 centimeters between the lines. And when we see the 3 lines, we pull back the dilatator inside the introducer very quickly to prevent the problem with the fat. And then we press for a couple minutes. The result: occlusion of the great saphenous vein, and the next day we see the free saphenofemoral junction and occlusion of the great saphenous vein. No pain the first 2 days after injection.